Welcome everyone for this webinar. My name is Marcio Galiato. I'm the co-director of MHPSS.net. And here today, it's a very special webinar that MHPSS.net, in collaboration with the MHPSS Collaborative, is really happy, really proud to be showing and launching this webinar for showing today and getting as well your feedback for a very important exercise we have been doing for the last couple of months. I don't know if you have this feeling. I am also a field person, frontline person, and I was also responding for a couple of months to the Ukrainian current emergency. And I don't know you, but sometimes we look at the number of resources available outside that in so many languages, and it's just an overwhelming feeling, right? So there are so many guidelines, so many frameworks, articles, tools that really it's overwhelming. This is not the first time, but we are very happy to be doing this again, which is this exercise of curating all these documents, selecting them, searching for them in different languages and trying to put them together. Today is exactly the opportunity to be showing this back to all of you, to the field, to all the participants all over the world, and to show what we have done so far, and then we will be getting your feedback. So I'm really happy to show this first look of this exercise to you, and as well very happy to be sharing this session with my colleagues Ashley Nemiro from MHPSS the Collaborative, Kira Lomakina from the MHPSS Collaborative as well, and my dear colleague from MHPSS.net, Valeria Flores. You can chat, put your comments or questions during the chat directly there, and we will be collecting them. You can also do that in Ukrainian. For the Ukrainians that are here, I would assume that you already managed to realize that we are simultaneously translating this webinar, and you can choose the channel down there to the Ukrainian language. Thank you, and I am happy to hand over to Ashley Nemiro, who is the head of the MHPSS Collaborative, our great partner of this process. Ashley, over to you.
Thank you so much, Marcio, and a huge thank you to MHPSS.net for making this possible. We're really excited to share the resource collection with everyone. And thank you so much for joining to get a first look. And I want to just give you a bit of a history on how this resource collection came to be. And it was actually at the beginning of the Ukrainian crisis that we at the Collaborative and our funder HIAS said, what can we do as an organization that specifically focuses on children and families in conflict-affected settings to ensure that practitioners have access to the resources that they need in an emergency setting specific to children and families. And of course, we know that MHPSS.net is an incredible space for anything related to mental health and well-being. But we really wanted to take the time to curate a resource collection for all practitioners who were working and supporting children and families. And what we decided is it wasn't just for the Ukrainian response. It was the Ukrainian response really got us thinking that we needed this curated collection of resources, but we really see this as serving the Ukrainian crisis, but also more broadly. And the really beautiful thing about this resource collection is when you get to see it, you'll see that we have curated this list of resources that really span a lot of different topics and areas of work for anyone who's supporting children and families with a focus on mental health and well-being. We also know that there's so many resources out there, as Marcio was saying, and we really wanted to make it easier for practitioners to access them. We all know in our work that time is extremely valuable. And so if we see this resource collection, that you can go here and you can say, look, I'm looking for M&E tools to support me with MHPSS programming for children and families. And we want to make that accessible to you. Also, I think we know in conflict affected settings that it's often programming supporting children and families that we're hearing from practitioners constantly. We need more resources, we need more support, you know, what is available? And so creating this space on MHPSS.net also makes that possible for everyone. So I am really excited. You all will get a chance to interact with it, but you know, we've tried to create it in a way where it's accessible, it's user friendly, it's available in many languages. And we also want this webinar to serve as an opportunity for you all to give us guidance on how it's functioning and also what's missing. There were quite a few of us who collated resources with support from a lot of our colleagues, but we know that there's still buckets that you'll see when you jump on the website that there aren't resources available. So are we missing them? Also, this tells us, you know, that there's a gap and that something might need to be created. So it also helps us benchmark where we are in terms of children and family MHPSS resources. So I am very excited about this. And once again, just a big thank you to MHPSS.net for making this possible. There's been a lot of work that's gone into this. And so we're just really excited for you all to be here with us for the first look. And I'm going to hand it over to my dear colleague, Kira, to tell us a little bit about the process that the MHPSS Collaborative and MHPSS.net went through to develop this resource collection for children and families. So over to you, Kira.
Thank you, Ashley. Thank you. Yeah, it's been an interesting way together, and I would start saying that we have achieved some results, but also we are still working on it. And I'm going to present you and tell you about the stages we went through and what we've done, how we actually appeared here at this point. And I'm so glad to see colleagues from Ukraine and actually from all over the world. So yeah, we started in June, and we and I don't see my slide. Yeah, here it's going. Thank you. So we started in June, and we obviously we wanted, as Ashley said, we wanted this resource collection to be as much useful as we could do. So we started with several consultations with practitioners from all over the world, with our colleagues, with workers who actually provide services to children and families in different crises, but also in Ukraine, asking them to just give us some overview of the resources they're using currently, but also what gaps they see and what are the needs in information that they think could be helpful. We did that in different ways. So first was interviews, consultations, and meetings. Then we developed a survey asking people to share resources they are currently using, but also shared some ideas about maybe what is missing and what needs to be developed, or there's any information to be shared. And then in July, August, we started our several, it took us 10 months, I think, or even more. We started thinking about what should be the structure of the resource collection, how to structure all this. We know that there are a lot of resources, right? But we wanted to anyone who come to the page to find what they need very easily and understand the logic how they need to follow to find the resource. So we were trying to categorize all resources and identifying these categories and filters that people should use in order to find the best, in order not to waste a lot of time finding the needed resource. So once we developed a kind of a draft of the structure, we again we went to the practitioners in the fields and humanitarian workers from different organizations, asking them to provide the feedback, because we really wanted to know how it's going to work and what is missing. Did we forget about kind of a category, or we were trying to find the best name of the category? It also took us some time to find the names that will be clear and will be clear to everyone what they can find under this category. So later on, Valeria will show you the result of all these discussions, but believe us, it took us a while to come there, and it was interesting, but on not always easy work, just because we have so many wonderful resources. And so then we moved to the next stage, and the next stage was to try to select resources, because we want this collection to be as much practical and useful. And also we wanted resources to represent different sectors and programming areas and different areas of work that we are doing, so that you could find everything, like including practitioner tools, exercises, but also standards, and also some information about the protection sector, like everything that is about children and family that you can find useful in your work. So we created an Excel file, and the Excel file was huge and big, and it took us a while to understand how we can do this. But actually, each resource that is decided to be added to the resource collection goes through some stages of confirmation and submission. So we need to categorize it, we need to assign filters, keywords, we need to set up all the information about, like, years, publisher, and also to find what is important for us still, and it will be during the whole project. We went through the confirmation process, trying to set up the best description of the resource. So when you see the resource page, so you can easily understand, will it be useful for you? Will it help you in your work? Is it something that you were looking for? So we tried to make description as short, practical, and clear for everyone. So hopefully it worked, and we will be happy to get your feedback if that is so. And now we are here. This is the webinar, and we are doing this soft launch, but to remind you that it's our start, and we are going to work and continue the collection of the resources. And we will continue uploading new resources. So now you will see some of them, but till this spring, we are going to build this collection, and we invite you to this process, and help us. Like, if you know anything that you think should be there, please reach out to us, and we will tell you how you can do this at the end of the webinar. That's it from my side. I'm so excited to have it, and I'm so excited to see how it will work in practice. And and now I want to hand over to Valeria.
Hi, Kira, thank you. I'm just gonna show this presentation that is about the process behind the structure of the Children and Families MHPSS collection. I will briefly describe the thinking process behind the design, the general structure, the categories and filters of the collection. At the end, I will also show you an example on how to navigate the site. Please, as Kira said, keep in mind that this is a soft launch and the collection is still being built. We currently have around 60 resources, and we're still in the process of adding more, testing the website and improving it. And this launch is to involve the community of practitioners in growing and refining the collection. What you're seeing is a mock-up of how we envisioned the repository before the site was built. After a lot of thinking, we agreed that having 2 main ways in to browse the repository will be more useful and user-friendly. As you can see, the collection can be browsed by entering different sectors with category like child protection, general MHPSS, education, and also by programming areas or phases with categories like assessment, advocacy, and policy, M&E, and capacity strengthening. With this approach, we hope to make it easier for users to search for tools depending on what they were looking for. For example, if you want to assess an intervention, you can look for resources through the M&E category. Or if you're looking for resources for working with displaced population, you can search through the migration, displacement, and people on the move category. Next slide, please. So here's the first way in. This is by the sectors that are involved in MHPSS with children and families. Here we have created 12 main categories, and some of them are divided into subsections because they were very broad. We first have child protection that contains subcategories of unaccompanied separated children, children associated with armed forces or armed groups, children families in contact with the law justice system, and child trafficking and exploitation. We have general MHPSS, education, which includes subcategories of inclusive education, social emotional learning, and early childhood development. We have food security and nutrition that is subdivided in these 2 areas. Economic development, social protection, health, peace building, and human rights. Gender equity and inclusion that contains subcategories of gender-based violence and other marginalized groups. We have climate change adaptation and risk reduction that is divided in these 2 areas. We have migration, displacement, people on the move, camp shelter, management and WASH, and sports and recreation and art and culture that will also be divided in 2 subsections. As mentioned at the beginning, this collection is still being populated, so don't worry while going through it today if you found some categories or subsections with no resources. We still have many more of them to include. Here you will see the second way in, that is by programming areas or phases of an MHPSS response. Here you will find 9 categories: assessment, advocacy and policy, capacity strengthening, implementation, M&E, program design, research and evidence, care for staff and volunteers, coordination, mapping, and referral. These are not yet divided into subsections as they are relatively more specific than the previous one. Well, is it loading? Well, here you can see that when you enter into a category, for example, child protection, you will be able to search within child protection category or by selecting a subsection. In this case, we have selected unaccompanied and separated children. This is like a mock-up again. And then you will also be able to use a system of filters. These filters are key types of information about resources that could simplify and speed up the user search, but they do not duplicate the resource collection categories. We have the following 8 filters. We have language, we have target audience, if it's for MHPSS practitioners, policymakers, or community members. We have intervention group by age range, caregivers, and other characteristics. We have resource type, if it's a guidance, a practitioner tool, format type, if it's a PDF or a zip file. We have the context, if it's done for disaster, conflict, poverty, or climate change. We have publishing year and also location, if the resource was done for a specific country, city, or place. You will be able to select more than one filter at the time and also more than one option per filter to narrow down the resources to find what you want. Here I will show you a demonstration. So you need to find Ukrainian language activity resources to use in school in school setting for students between 12 to 17 years old. So I'm going to show you how you can use the Children and Families Resource Collection to find the resource you need. So first, you will have to open the resource collection and try to see which category will help you better to find what you're looking for. Here they are asking us for resources to use in school settings, so we can go through education. they ask for resources for students between 12 to 17 years old and resources in Ukrainian. So you'll see that your search has been narrowed down to 4 resources that you could use. And for example, we want to use the I Support My Friends resource kit. Here you will find a description of the resource and the documents it contains as well. And here you will be able to download each of these documents and also the translation that the resource are available in. We also find out that if you're using Chrome, you can translate the site to your preferred language. For this, you will have to do a right click, then go to translate. In my case, it says English. And then you will have to choose another language and then select your preferred language. In this case, we're gonna select Ukrainian, and the whole site will be translated. So you will be able to browse through the repository and also select the filters that you need or that you wanna use. So thank you. I hope you find this tool useful.
Excellent. Thank you so much, Valeria and Kira, for the excellent explanation of this exercise. And we now have a surprise for you. You are going to try yourself. It's not enough to just look at it. You have really to try and experiment this exercise and see how helpful it is or not, and tell us as well. So we are going to go to breakout rooms. Where we have all my team here that's going to help each room and navigating to the process. They will show the link and they will give the exercise on trying out this resource collection. Welcome back, everyone. I'm 100% sure that we probably interrupted you when you were the highest moment of the discussion, no? As always. The climax of things. But we want to hear from you now a little bit. It's very few minutes only, unfortunately, but I hope this was an opportunity to give you the taste of a little bit of this exercise, of this resource collection, and at the same time, you were able to provide some initial feedbacks, you know? And we truly rely on your feedback process. So I will hand over now to my dear colleague, Ashley, to conduct this initial feedback session.
Thank you so much, Marcio. And thank you everyone who is in my breakout room as well. So if you want to just put in the chat, so initial thoughts, the first look at the resource collection, how easy was it to use it? How easy was it to navigate, find what you were looking for, specifically the PFA guide, also an advocacy tool, and then the last prompt, which was your favorite resource. So generally pretty easy, very easy and user-friendly, practical. Yeah. Any other thoughts? Did anyone go through and look at all the different languages that resources are available in? Yep, found it easy and comfortable, practical. It's easy to find through the filtering process. That's great to hear. A lot of effort went into us developing those filters to make it as user-friendly as possible. Pretty easy. Great. Thank you all so much for that feedback. Yes, the filtering process, yes. And were you able to find the materials you were looking for? So whoever put in their favorite resource for children and families' mental health and psychosocial support. Yes, I did. Yes, great. Yes, all the material. That's fantastic. Wonderful. So here's the important question, is what key resources from your perspective were not yet added? And to add on to that question, so what key resources were not added yet? and maybe what key resources were not translated into languages that you would like to see them translated into. Yep, some resources are not translated into Ukrainian. Yep, violence against children. Thank you so much, Kevin. We will definitely save that. We really appreciate it. My Heroes You is definitely on there. Most important heroes added but are not available in Polish. Thank you so much for that feedback. Yes, and please send us specific links, just like Kevin did. That's extremely helpful for us. Maternal mental health. Yeah, Mari, incredibly important. And if you have a resource that you see is missing on there, please add it into the chat. And we'll also give a way for you to send us feedback after the webinar. Thinking healthy. Yes, that is correct. That's one resource that we need to add. So any other impressions or ideas that you have? You can type them into the chat. M&E tools. Yeah, absolutely. And one thing that we talked about in my group as well is that this resource collection not only serves as a repository and a place where you all can go and access resources specific to children and families MHPSS, but it also gives us a sense of what's missing, what still needs to be created, where the gaps lie. Great. Job is massive and amazing. Thank you so much. Thank you for your comment. The orientation on MHPSS. Thank you for sending. Great. That's wonderful. So you all can keep adding that to the chat. Wonderful. And Ananda, next slide, please. Okay. So here are the next steps, and we really appreciate everyone taking time to spend with us today, and we want to let you know what this is going to look like moving forward. So as this is the first look, we are going to continue developing the Child and Families Resource Collection. So continue adding resources that you are telling us about here now, and also that other practitioners send to us. Also, we'll continue to add translations and update the resource collection as new resources come out. We also are going to have a link that will give you an opportunity to then suggest resources for the resource collection that we will review and then include if it meets the criteria to be on the resource collection. And the second to last thing is this is the first webinar in our webinar series. So we're going to have 3 more webinars that are focusing on available resources. And we're going to bring in different voices and practitioners working across the globe specific to children and families MHPSS. So our next webinar will take place in November and then January and March. And we're really excited for you all to join us for those and see how this resource collection continues to evolve. And the last part here, which is very exciting, is the community of practice for children and family MHPSS. So if you're familiar with MHPSS.net, you'll know that they have a few communities of practice, and it really is a space for you as practitioners to go on, connect with like-minded people, connect with peers, connect with practitioners across the globe, and ask questions about this resource collection, about child and family MHPSS. And really, we want this to be a space for you to learn from each other, to engage with MHPSS.net, and to ensure that you really have the right resources in place to make sure that children and families are focused on in conflict settings. So thank you all so much, and I will hand over to Marcio for the final words, and we really appreciate your time and would love to see you back in November for our next webinar.
Thank you so much, Ashley, and well done, everyone. We have done a brilliant job with time today, which I think is one of the indicators of success in a webinar. Just to reinforce back again, because I see that it's such a great value, the community of practice overall. MHPSS.net is a global community of practice of practitioners. It's not an organization with a specific ownership of the specific group of people. It belongs to the field, to the global field of MHPSS, we are the ones here today, and tomorrow will not be us. And that's how the ethos of this organization keeps going for so many years. And we truly believe that community of practice, putting people like here today, people from so many different countries, so many contexts, so many different backgrounds, is really what makes it rich. It's the people behind the scenes of every action that we do. So we do encourage you to join the community of practice and participate. It's not a place that you just go. It's a place of engagement. And what makes that real is exactly your contribution, your participation, like today we had here. So that's it. I'm sad to say that we are concluding sad but happy at the same time, but just to say a goodbye in a way that we are going to see you soon again in 2 months' time, no, in 1 month time for our next webinar. And thanks for your participation, for being here today. We have a link for the exit survey that it's very useful for us. It's very important for us that you give your feedback of how it went today. So please press this button. Otherwise, it's not good, because then you have dreams about it. You keep remembering about that because, oh my God, I did not press the survey link. And so go for it. It takes 2 minutes only, and it'll be over for that. And then you'll forget about us. Thank you again, and see you soon.